Hi everyone, it's Danny here.
And I'm Daisy.
Today we're going to be looking at a case study, kind of emphasizing how important it is to catch acute compartment syndrome early.
Especially, in those situations where the patient's history might be a little unclear.
Exactly. Thinking about those patients who maybe present after, say, drug or alcohol use, it can definitely make things trickier.
For sure, but even though it can be a serious condition, we can manage it effectively.
As long as we diagnose and intervene quickly enough, right?
Exactly.
A case like this is always a good opportunity for a refresher. Plus, it's a chance to really hone in on those subtle clues that can sometimes be easy to miss.
Absolutely. It's those little details that can make all the difference.
All right, so let's jump into it. Picture this. You get called to the ER, and you got a 33-year-old male found unconscious. History. Night of heavy drinking, possible fentanyl use.
Okay, so right off the bat, we know we're dealing with a potentially complex situation.
Exactly. The guy's groggy, he's in pain, and he can't quite remember what happened. But here's the thing. He woke up, and his left hand, he says, it feels like it's on fire.
That's got to be concerning.
And you take a look, and you see it. His forearm is visibly swollen. It's tender to touch.
So there's definitely some inflammation going on there.
You bet. But his vitals, they're stable, thankfully.
Okay, that's good at least.
Problem is, he can barely move his wrist and fingers.
So we're looking at restricted range of motion on top of the pain and swelling.
You got it. You order x-rays to rule out a fracture, and they come back negative.
Negative for fracture, huh? So now the question is, what's causing this pain?
And this is where things get really interesting, right? Because even though there's no fracture, we can't rule out acute compartment syndrome.
You're absolutely right. And in a situation like this, especially in the hand and forearm, compartment syndrome has to be high on our list of possibilities.
Totally. So let's talk pathophysiology for a second. What's actually happening inside his forearm to cause this?
Okay, so picture this. Inside the forearm, you have these different compartments, right? And each compartment is surrounded by fascia, this tough, fibrous tissue.
Like a container almost, right?
Yeah, exactly. It's a closed space. And when our patient, let's say he fell or even just lay on his arm for a long time, it can cause swelling.
Okay, so that swelling's got to go somewhere.
Exactly. And it's trapped within that fascia. The pressure starts to build up inside that closed compartment.
So that increased pressure, that's what's causing the problem.
It is. As the pressure builds, it starts to compress the blood vessels and nerves inside that compartment. And that decreased blood flow, that's what can lead to tissue damage if it's not addressed. If we gently extend our patient's wrist or fingers, and he cries out in pain, that's a big clue. That pain with passive stretch, that's a classic sign.
So we've got pain, swelling, limited range of motion. What are some other things we should be on the lookout for? What happens if we don't catch it early?
Well, if that pressure keeps building, the symptoms can get a lot worse and pretty quickly.
So what kind of progression are we talking about here?
Initially, he might have some paresthesias, like tingling or numbness in his hand. As it progresses, he could start to lose sensation altogether. You might see some pallor. His hand might turn pale, and eventually, if it gets really bad...
It can lead to paralysis, right?
You got it. And if the blood flow is completely cut off, you might not even be able to feel a pulse in his wrist.
Okay, so even though our patient has sensation and a pulse at the moment?
We have to be incredibly vigilant. We need to monitor him closely for any changes.
Absolutely. And there's a specific exam finding for the upper extremity that we should be aware of, right?
Yes, exactly. That's called the intrinsic minus position, or sometimes it's called claw hand, and it's where the fingers are kind of.
Well, they're extended at the MCP joints, those are the knuckles, but then they're flexed at the PIP joints, the middle joints of the fingers.
So if we see that, particularly in a case like this,
it's a huge red flag.
Yeah.
It's highly suggestive of acute compartment syndrome in this context.
Got it. So how quickly do we need to get orthopedics involved? I mean, we're suspecting compartment syndrome. What's next?
We need to call them early, even if we can't get compartment pressure measurements right away.
Right, because those aren't always readily available, are they?
Exactly. But we can't wait. Time is absolutely critical here. The sooner we get orthopedics involved, the better the chances of a good outcome.
Because if they need to do a fasciotomy, the sooner the better. That procedure relieves the pressure by making an incision in the fascia, allowing those tissues to expand and get that blood flowing again. And delaying that procedure, well, that can lead to irreversible damage.
Okay, so to sum things up, for patients who are found unconscious, especially with a history like this, we need to be very suspicious of compartment syndrome.
Absolutely. And even if there's no fracture, we have to consider it.
We have to catch those early signs, that pain that seems out of proportion, the swelling.
And any changes in sensation or that intrinsic minus hand position?
We can't afford to miss those clues.
Nope. And early orthopedic consultation is absolutely key to preventing permanent damage.
Couldn't have said it better myself. Now, before we wrap up, I want to leave our listeners with something to ponder. So we focused on the forearm today. But what if this happened in a different location, say the lower leg or even the abdomen?
That's a great question.
Yeah.
How would the presentation differ? How would we adjust our approach to diagnosis and management?
It's exactly something to think about. And with that, I want to thank everyone for joining us.
Always a pleasure.
Until next time.